Welcome to Business Connection. I'm Liz Spencer. We're on location today. We're at the Edward Neurosciences Institute in affiliation with Northwestern Medicine. Lynn, nice to see you.
Nice to see you as well.
Now, you've had some exciting growth here at Edward. You want to tell me a little bit about where we're at and what's going on?
I do. So the Edward Neuroscience Institute over the last couple of years has really expanded. So I just wanted to share a little bit about that. On the neurosurgery side, we've added an additional neurosurgeon, and Dr. Mike Casey actually is from Naperville. He graduated from Naperville Central, so he's really glad to be practicing back in his hometown. So he's joined his partners, Dr. Caron and Dr. Schuler. For neurology, we have added 3 new neurologists this past year. Dr. Wi-Fi is a new critical care intensivist, so he's joining Dr. Sajid. And the 2 of them are able to provide around-the-clock, 365-day coverage in our neurocritical care, so taking care of the sickest patients that we end up seeing here at Edward. And then we've added 2 general neurologists, Dr. Stashnik and Dr. Mathina, who both just finished their fellowship in neurophysiology. Additionally, for neurology, we are up to 6 sites now, so providing coverage all across the service area that Edward provides care to. Dr. Shaibani will be talking about all of the things that he and his partners do in the neurointerventional lab. So it's been an exciting time for us.
It is exciting, and it's exciting for the community because it's right here in our backyard.
Correct.
And when you're seeing someone for neurology or anything like that, it's a little bit scary time, so you want to be close to home.
Right.
And so tell me a little bit, we were talking off camera that lots of things have changed. What is exciting about what's happening now, and what can you treat better than you ever could before?
Well, I think what we have now is a lot of great data that came out of multiple trials that show the effectiveness of what we're doing for large vessel stroke. So stroke, as you know, is a sudden cutoff of blood flow to part of the brain. And the most devastating strokes are the ones that involve the larger arteries that take blood to the brain. And in 2015, we were fortunate, 5 separate well-done trials came out and showed incontrovertibly that doing the endovascular treatment of stroke really does make a big difference in outcome. Not too long ago, we didn't really have any treatment for stroke, and now it's really become so much more advanced. We are trying to get to the brain as quickly as possible, and because, as you mentioned, it's the program is in people's backyards, it makes a huge difference because time is brain. We lose 2 million brain cells a minute when one of those arteries closes. So we like to actually open them, the arteries up as fast as possible, and often the fastest way of doing it is for the doctor to come to the patient rather than trying to move the patient a certain distance to the physician.
So do you see most of your patients from the ER coming in really critically, and then you're on call all the time?
Correct. So we have a team of 3 people that cover the acute stroke. We also have our neurosurgical colleagues, because we deal with both what's called ischemic stroke, which is the majority of stroke, and we also deal with the bleeding kind of strokes. And so it's a collaborative partnership between the neurointerventionalists, of which there are 3, the neurosurgical team and the neurology team. So yeah, one of us is always here physically on site during the day, and then we have actually 2 people on call at night in case there are multiple events happening. The nice thing about Edward Hospital is they've really made a commitment to having the right equipment, the right people, so you need both physical and human infrastructure for it. And that's where the neurocritical care doctors that have been hired and the neurocritical care, mid-level providers that are providing the 24/7 coverage comes in. And I have to say we have our team out there of the interventional radiology technologists and nurses and the anesthesiologists who all converge very quickly to treat these patients coming in.
And we're sitting in a very high-tech room too.
Correct.
As you mentioned, you need both equipment and people. The equipment now is so much more friendly and leaves us a little bit more whole when you go in and have to help us out. It's not
Correct.
quite the drastic surgery that it used to be.
Yeah.
It has to help us with recovery.
Absolutely. I mean, I think there has been a revolution in the equipment, and that speaks to, I think, the sort of the drive of the medical community in this country, especially on the innovation on devices. When we started doing stroke intervention, 10, 15 years ago, the devices were much more primitive, and just the pace of change has been incredible. So we are much more effective at opening those arteries. We used to come in for all those cases, but our success rates weren't as good. Now the success rates are almost 90% for opening the artery up. So that's been definitely a sea change also in just the equipment we have available for us to use.
That's awesome. Thanks for taking time out to tell us a little bit about it. And thank you for your commitment to what you do and for Edward's commitment for bringing this to the community. This is a wonderful thing, and now we have a lot more hope than we did 5-10 years ago. Dr. Caron, thanks for joining me and telling me a little bit about what you do. Tell me about the neurosurgery here and what makes it special.
Well, our neurosurgery program is affiliated with Northwestern. The 3 neurosurgeons and the 3 interventional neuroradiologists are faculty at Northwestern, but we spend 90% or more of our time taking care of patients here at Edward. So we bring the academic developments quickly to the community, and that just puts us a little ahead of the rest of the area. In addition, our neurosurgeons just practice here, whereas community neurosurgeons generally are on staff at 3 to 5 hospitals. And each of us came from different training programs, so we each have little areas of neurosurgery that we've got more expertise at, and we share those patients with each other, both at the neurosurgical level and then with the stroke neurologists, the MS neurologists, the interventional neuroradiologists that you spoke with earlier, Dr. Shaibani. So it's a community of neuroscience practitioners all interacting on a daily basis to really help the patients get a better answer.
You have a brain tumor clinic here. How does that work, and why is that so important?
Well, the treatment of brain tumors, the malignant tumors in particular, and some of the benign tumors require neurosurgical care. They require a radiation oncologist to treat the tumors, and they oftentimes have a medical oncologist for chemotherapy. And so what we do for our clinic here that's unique is that the patients come to an appointment. We've been in the conference room, looked at all their scans, made the decisions on their plan, and we walk in and discuss the plan with the patient and their family, and they can answer questions with 3 doctors at one appointment. The doctors don't have to then say, oh, I'll call him and get back to you. It all gets done in one day, one visit. It's more efficient for the doctors, it's more efficient for the patients, and it really makes the care much more coordinated. We're actually launching a clinic in cerebrovascular surgery with the same concept. We've been doing the brain tumor clinic since 2009, and we're going to launch a formal cerebrovascular clinic with the same kind of concept.
That's exciting to see that collaboration and have it all come here to the community in Naperville, Illinois.
Well, it's nice that we can bring things instantaneously that are up and coming at the academic level to the community, so people don't have to travel downtown to get their care.
That's awesome. Thanks for taking time out and joining me. I appreciate you sharing your knowledge.
Enjoyed our visit. It's great to be in Naperville.
Thank you for joining me. Tell me a little bit about MS and Edward Hospital and what you're working together to do.
We established the MS clinic in Edward Hospital, and the whole intention of this is to focus our attention to treating and diagnosing the disease on a timely basis and be able to institute treatment on a timely basis, knowing for a fact that there are now at least 14 available treatments, each with its own unique mechanism and side effects. So we had to coordinate and be able to have that expertise to help patients choose the right treatment for their disease and be able to, in a more expert fashion, monitor the side effects of each treatment.
Is it unusual for a community hospital, even though this is a regional hospital, to have an MS clinic?
Yes, I think so, because most MS clinics are located in tertiary big centers, so they are usually centered in big cities. It's one of the recognized MS partners in care by the MS Society. So we do have a legitimate clinic here where people can come, and we have access to new trials and treatment.
That's exciting. Thank you so much for taking time to join me and tell me a little bit what you're doing here. It gives us a lot of hope. We'll be right back with more Business Connection.